All right, well, hello, everyone. I think we may have had one more person join us. If not, people will be coming in shortly. I want to welcome everyone to the presentation today. My name is Alicia Campolito. I'm the Area Community Relations Director with the Lakeshore. Before we get started, I would love to share a little bit about our beautiful community here. Many of you have perhaps visited the Lakeshore previously. For those of you who are less familiar, I would like to share with you that we are a premier retirement community that sits on the south shore of beautiful Lake Washington. We have 156 senior apartment homes offering a variety of studio, 1-bedroom and 2-bedroom floor plan options. Right now, we are moving new residents into the community. We are able to do full and in-person community tours. If you're interested in learning more about us at the Lakeshore, interested in a tour, making a reservation, please feel free to contact Jane, who's in the background, Lisa, or myself in the Community Relations Office. I also want to be sure to share and make you aware of our extraordinary partnership that we have with us and the other 7 communities with the University of Washington. Our residents benefit from this partnership to deliver innovative programs designed with healthy living in mind. The partnerships that we have are with the School of Pharmacy, the School of Social Work, and the School of Nursing. For nearly 3 decades, Air Living has pioneered a powerful partnership with top-ranked University of Washington School of Nursing. The partnership allows residents to benefit from evidence-informed wellness and active aging programs. Oops, previous slide. There they are. Before we get to the main event, I'd like to tell you a little bit more about our presenters, Pat and Norma. Pat is a lifelong Washingtonian, born and raised in the Tacoma area, and a University of Puget Sound alumnus. Pat is a 20-year insurance veteran and puts his knowledge to work every day for our clients. Norma is a native Texan and proud Washington State University graduate who spent 25 years in high tech and joined Pat 3 years ago. Pat and Norma live in the Newcastle Renton area with their daughter Katie, an incoming junior at Washington State University. How proud you must be. I will go ahead and get things started. And at the end, of course, of the presentation, we will answer any questions you might have. So without further ado, I'm going to flip the screen over to Pat and Norma so they can get started.
Thanks, Alicia. Here we go. Share. View slideshow. Okay. Just checking you can see my slides.
You look good.
Great. So again, thank you, Alicia, for that warm welcome. And we were, Pat and I looked at each other and said, what a great relationship you have with the University of Washington. We did not know that. We typically, you know, we are WSU fans, but we love the U of W and what they bring to healthcare for all of our residents. So that was a really great educational moment for us as well. So thank you for that. So today, we're going to talk about Medicare. Now, as the title of the presentation says, this is when you need to make a change or options. And Pat and I have a firm belief that you need to understand the basics of what Medicare is before you can make changes. So some of you this might be a little repetitive, but it also might help just improve your muscle if you feel like you've got everything going. And for those of you who are maybe still nervous about Medicare and don't understand, this will be a great option as well. We will make this presentation available to Alicia, and if you would like to have a printed copy for a resource for you, you're absolutely welcome to have it, and we'll make that happen at the end of the presentation. So as you can see, our agenda, we'll talk about the basics, the parts of Medicare, and by design.
Can you hear me okay?
Yes.
Would you have a give subtitles a try on your display? Are you able to maybe click that off? You look like you're in presentation mode rather than in actual slide power show mode. So
okay, let's see. Give subtitles a try. I don't want to do that. I see.
Nope. I mean, it could be fun, but you want to definitely flip over to the there.
Is that better?
Nope,
last night. Microsoft did an update, changed to Office 365, and yikes, pikes, click. I don't like that.
You got it. Close out of that with the X box at the top, the little X at the top.
Let's see if that will help.
And then you've got the recording showing, so perhaps,
Maybe display settings up at the top.
right, display settings at the top in the
Yeah.
middle. There you go. Click on that. Presenter view and slideshow. No. There you go.
Perfect.
Okay, good. So we still have the subtitles, so we'll just deal with that for right now and see if we can get that. Let me see if I can get that off, unless
take a minute.
everybody wants subtitles. I'm going to turn it off.
More settings, maybe.
Yeah, yeah. Turn off. Wow.
They really want you to have them.
They really want us to have them. Wow. Okay, well, I guess they want us to have them, so we'll deal with that. So as long as the slides look okay, then we'll just continue on. So Alicia, I'm good to go?
You're good to go. They look good now. Thank you.
Okay, thank you. Okay, so as I was saying, we're going to talk about parts A, B, D, and C, and that's out of order for a reason, and we'll learn about that in just a few. Medicare supplements and the options that you can take when looking at Medicare. So a little bit more about us, as Alicia said in our bio, we are proud alumni of our respective universities. We love to spend time in the area. We hike, we like to play golf, we're part of book clubs, gardening, and more importantly, as I think all of 2020 taught us, that family and friends are truly important, and your community that you surround yourself with can sustain you through many, many things. So that is an incredible blessing that we have to have our family and friends close by. In the community, we feel it's important to volunteer. I sit on the Chamber of Commerce for the Newcastle Chamber of Commerce. We volunteer with the local YMCA to pack lunches once a month with for children who have food insecurities over the weekend, and we pack about 200 lunches a week. And that's an important aspect to keep our kids healthy. And over in Pullman, I sit on a board as well to help with my sorority that I was at while I was in college. So as we said to Pat, and we're licensed here in the Washington State, you know, the combined with 20 years experience with Pat, and then working with him over the last 3 years, has been a great change from high tech to insurance. One thing that's really important for you to know, and this is regarding no matter if you live in Renton, Seattle, Washington, any of the other 49 states in the union, our services, and people like Pat and I who are brokers, our services are no charge to you. If someone calls you, emails you, sends you a letter and says, hey, would you like to do a Medicare review of your current benefits, and they say only for $5, $20, or $200, that is a scam, and you need to not bite on that offer. It is free. If an individual decides that they want to work with Pat or myself, and you decide to enroll in a plan with us, we will be compensated by the carrier. You will never exchange financial information or monies with a broker. That is definitely a no-no. So make sure you add that to your list of potential scams that you need to be watchful for. The other thing that we do with our clients, we act as your advocate when needed. There are times when the explanation of benefits is confusing, or there was a charge that wasn't covered. And so we are there to help work with you and join you on your call with member services to find out what is going on with that. So that is something that we do. And again, that does not, we don't charge for that. That is part of our services that we have for our clients to help them along their Medicare journey. We are totally privacy compliant, and that is required by law. So you can rest assured that we are keeping your information safe. We also do a quarterly newsletter of things that are happening in the insurance around Medicare once a quarter. So that is something we enjoy doing, and we love communicating that way with our clients. And the last thing, we do have a website, as you can see there, and we do talk about our clients who've been gracious to tell us how they like to work with us are up there, and you can take a peek a little bit more about us. So a little bit about, again, making sure when you're selecting someone, you want to make sure that they're independent and they're working to find the right plan for you. Do they represent more than one company? Because if an individual says only represents one company, you will not be able to see the other ones, and make sure that you're finding the one that fits for your prescription drugs, that fits for your doctors, that fits for the benefits that you want to see. So it's super important to work with an individual or individuals who represent multiple companies. And this is a really important point too, is that do they specialize in Medicare, or is this a sidebar? Because there are times when, you know, Medicare can be very complicated, and you want to make sure that somebody is there to be knowledgeable to you and not do it as a side business that will just leave you more and more frustrated. So those are just some things as you're thinking through to keep in mind. So we're going to move to the basics. And this is a really great basic slide, but if you are over 65, or you're under 65 and disabled, or you're living with end-stage renal disease, you are eligible for Medicare. And in the country, and this is a little factoid, the next time that you get together for one of your community events, 10,000 people a day are turning 65 in the United States. And that trend will continue till about 2032. So there are a lot of people who are turning to Medicare every single day. And Medicare was designed for that. However, as I said, there are people who are disabled under the age of 65 who are also eligible for Medicare. And if you are one of those individuals who are disabled and feel that you might be Medicare eligible because of your disability, we can certainly work with you and determine that. There are 70+ diagnoses that are currently labeled as disabilities, and then there's little details underneath those. So do check to make sure in case you are eligible. And for those of you who are not 65 yet, this is what the Medicare card looks like. About 3 years ago in the country, there was a massive movement to take Social Security numbers off of Medicare. And so now each individual has their own unique Medicare ID number. It's called an MIB, and that is your card. If anybody asks you for your Social Security number, we all know that is a big no-no. So again, for Social Security, your card is a unique number, and as you can see, it has, you know, on the example here, the 1EG4TE, you know, so on and so on. That is your unique number that you will have, and that is what you will give to carriers. When you turn 65, you are automatically enrolled in Part A, which is hospital. And you then have to enroll in Part B. And Part B is for your services, for the providers, your primary care, your specialists, physical therapy, all those individuals in healthcare who help with your healthcare. So you will need to enroll in Part B. If you're under 65 and you're not quite sure how to do that, we have a sign-up sheet that we give to folks that is very explanatory how you can do it either online or via the phone. In person is still not available right now, but we can walk you through that and we can get you that form as well. Now, if you are under 65, your card will arrive about 3 months before your 65th birthday for Part A. And if there's anyone I'll go through this pretty quickly. If you're anybody on the call working past 65, you absolutely can work past 65. That is not a problem. The one thing that you always need to be careful of, and if you are on this call and you have an adult child who is nearing 65 and still wants to work, that's great. That is considered credible coverage. However, COBRA is not considered credible coverage. So that is an important point to know for anybody who is going to continue to work past 65. And we can go through that if you have an individual in your family or friend group that is planning to do that. Okay, I'm going to turn it over to Pat, and he's going to walk you through a few more of the slides. And on this slide particular, there's a lot of columns on it, and Pat will take it away. Pat?
Well, good morning. Pleasure to be with you today. So Medicare realized that there are a number of different ways to utilize Medicare, turning 65, being disabled. But once you're on Medicare, there's a certain number of people that move, relocate, what have you. And there needed to be a mechanism. How can their insurance follow them? So in that third column from the left, the special enrollment period, and this is very important. You can take your insurance with you if it happens to be available to your destination, wherever you're going to be moving, or you can simply choose a new insurance plan. And that's called, and you do that under what's called a special enrollment period. Let's say you're coming from California and you're going to move to Lakeshore, you would have 63 days from the time you get to Lakeshore to choose a new Medicare insurance plan. How we do that is we simply would enroll you in a new plan, and we would give the explanation of why you're applying as a special enrollment period. Now that would only apply to Medicare Advantage plans. Medicare Advantage plans operate off of networks, so you would have to go into a network that serves the Lakeshore area. If you are on a Medicare supplement plan, you don't need to do anything. You can stay on that plan. You do need to notify the insurance company that you've changed addresses, but you can stay on your Medicare supplement plan if that's your choice for Medicare insurance. Okay, let's talk a little bit about Part A and Part B of Medicare. Now, I'm going to go through these kind of quickly but I do want you to pay attention to one thing. You'll notice on here that there are deductibles and copays, and we'll talk about that when we get into the plans. So Part A, hospitalization. For Part A and Part B, your requirements for eligibility are either 65 and older, under 65 with a qualifying disability. On Part A, you have to work 40 quarters, 10 years. You have to have paid into the system. That's that annoying small little payroll deduction that's taken on every paycheck, and that buys you Part A. Do you get that at no charge when you turn 65? Part B. Part B does have a monthly premium. Again, you have to be 65, work your 40 quarters. And we'll talk about more about the monthly premium and so forth as we go along. If you only had Medicare Part A and Medicare Part B, Medicare is going to pay 80% of the bill. You're going to be responsible for 20% of the bill. Those copays and deductibles that you saw on the previous slide, as well as the annual deductible here for Part B, you will be responsible for as well. Medicare is only going to pay for qualifying and medically necessary services. Medicare does not pay for prescription drug, dental, vision, hearing, naturopaths, and so forth. Now, here's a little interesting thing called IRMAA. It's the income-related monthly adjustment amount. I'm not going to read this all to you, but essentially what IRMAA says is this: the more you make in income, the more you're going to pay for your Part B premium. So what is used is the adjusted gross income off of your last two filed tax returns with the IRS. So off of your last two 1040s. And Medicare has access to see that. They will tell you what your IRMAA is going to be as relates to your Part B premium. So that's not something that we do, but here's the chart for this year. And as you can see is on the left-hand side, the two columns on the left, it shows the income bracket. So it can get a little bit expensive, but that's how it works. And Medicare will inform you of what your monthly Part B premium will be. Okay, when a lot of people want to know, when do I apply for Medicare Part B? Well, we tell people to get started, start thinking about it 6 months prior to your 65th birthday. You can submit online 6 months prior to your 65th birthday at medicare.gov or through ssa.gov through the Social Security website. Doesn't take that long. It's about a 40 to 50 minute process to apply. Can take anywhere from a week to 7 or 8 weeks these days to get your Medicare card. And here's what it looks like. Here's on the Social Security website. This is the page where you would apply for benefits. So there are 3 ways how you can sign up for Medicare. You can go in person to a Social Security office, although right now they're closed, but with all the states reopening, say the Washington reopened yesterday, we're hopeful that those local offices will be opening up. You can do it on the phone. It's a little bit of a cumbersome process. You make the first phone call, and they're going to put you in their queue to call you to make an appointment. And they will set that appointment for you. And then at that appointment, you will actually, when they call you back on the appointment date, they will actually then enroll you for Medicare, or you can do it online. Okay, we're now going to talk about Part D of Medicare. Part D is prescription drug coverage. In 2003, Congress passed the Medicare prescription drug law. Everyone at 65 years of older now is required to have, at minimum, prescription drug coverage. So if you don't, you can get penalized. It is a voluntary program, so you don't have to sign up for it, but be aware that if you don't sign up, you can be penalized. The program prescription drug is run by private insurance companies. There is a monthly premium for the coverage. You will pay a portion of the drug cost, and though that's called the copay, could also be a deductible. Coverages do vary from plan to plan, and the Medicare requirement is that the plans must be equal or better to than the standard Medicare benefits sent by the Center for Medicare and Medicaid Services, or CMS. Now, you may have also heard of the thing called the donut hole, and here it is. This is a unique mechanism in prescription drug for Medicare. It does not exist in any other prescription drug health insurance plan. And here's how it works. The first stage we call the deductible phase. If your plan has a deductible, and not all of them have a deductible, you must first satisfy the deductible. Now, these plans reset January 1st, every January 1st. So you start out afresh every January 1st. Once you've satisfied your deductible, you then go into what we call the initial coverage phase. Once you have, once that there's been $4,130 spent on your prescription drugs, and it's broken down 75-25, once that gets to be $4,130, you then go into what's called the coverage gap, or also known as the donut hole. Now, in the initial coverage phase and in the coverage gap, you're going to pay, or the plan is going to pay 75% of the cost of your medications, and you're going to pay 25%. In the coverage gap, once you reach 6,550, then you go into what we call catastrophic coverage, and your copay for drugs will be 5%, and the plan is going to pay 95%. It is a little bit of a different mechanism. They keep telling us it's going to go away. but it looks like it's here to stay for at least a couple more years. Some common terms that you need to be aware of about drug coverage. The formulary is just simply a list of drugs covered by each plan. It is not a standardized list. This is why it's important when you're choosing a plan to take a look at your medications to make sure that they're in the formulary of the plan you're buying. That's just, we can't emphasize that enough. It's very important. Prior authorization, some of the drugs require prior authorization. If you don't get the approval, they won't pay for it. I hate to be blunt about it, but that's just the way it works. Quantity limits, some of the drugs, specifically the opioids, you can only get a certain quantity for each refill period. Step therapy. Step therapy is a mechanism that the insurance companies have to get you to try the lower cost drugs, the generics, and see if there is one that works as well as a name brand. The generics are typically cheaper, and the insurance company does have the right to request that of you, that you try the step therapy process. Transition supply, when you're moving from a plan to plan, you can get a transition supply of your current medications. A couple of other things that are available to Medicare recipients. Extra help, also known as the low-income subsidy. Under a certain income level, it's about $17,000 a year in King County. You can qualify for extra help, and they will give you assistance paying your monthly prescription drug premium, co-pays, co-insurance, and deductibles. How do you qualify? You have to contact the Social Security Administration and make application, and then they will make a determination of your eligibility. Late enrollment penalties. I mentioned this earlier. There are late enrollment penalties. Part B, this is the onerous one. And there are some caveats that come with this that make it really punitive. If you don't sign up in time for Part B, the late enrollment penalty is 10% of the monthly premium. However, there's only certain times you can sign up. If you miss the sign up periods throughout the year, there's only certain times that you can sign up. So if you're in that position, give us a call and we'll walk you through the process. It's because it's not simple. Part D, the prescription drug, it's an additional 1% of the Part D premium. And how it works is it's based upon a $32 average premium throughout the country, times 1% times the number of months that you did not have prescription drug coverage. Once you have these penalties, they are for life. They never go away. And there's the calculator for the prescription drug penalty. Okay, Medicare Advantage Part C. This is a program that was passed in 1997, and the first plans hit the marketplace in 2002, 2003. Under original Medicare, Part A and Part B, what we call original Medicare, they only pay medically necessary medical procedures, prescription drug, dental, vision, hearing aids, a gym membership, none of that is covered. Under Medicare Advantage, the insurance companies are allowed, these are offered by private insurance companies, they are allowed to include those things, the gym membership, dental, hearing, pharmacy, vision, care coordination. You'll have all of the insurance companies have a care coordinator you can work with if you need help managing your health care. And they also, all of those deductibles and copays, remember I said, remember those from that very early slide, all of those copays and deductibles are rolled into this plan. So you only will pay the stated copays in the plan. These are what I call pay for play plans. Every time you use it, there could be a copay or a co-insurance. Prescription drug, there may also be a deductible. But these are outstanding plans. It's a bundle of insurance benefits, and the monthly premiums on these plans on Medicare Advantage ranges from $0 a month to about $100 a month. And again, here's how you qualify for a Medicare Advantage plan. You must have Part A and Part B. You have to continue paying your Part B premium. That's a big factor. We've had that happen. Not have renal end-stage renal disease. All that's going away, however. A valid enrollment period. We saw that on those earlier slides. Either you're turning 65 or you have a special election period by moving or relocating, and you must live in a plan's service area because they all operate off of networks. And again, here's a replay of that earlier slide that showed all of the enrollment periods. I won't go into this very much, but here's the big one. When you turn 65, you have a 7-month initial enrollment period, 3 months prior to the month of your birthday, the month of your birthday, and 3 months after the month of your birthday. During that 7-month window, you can enroll in a Medicare Advantage plan or a Medicare supplement plan at any time without penalty. And open enrollment. This is a important part. If you choose a Medicare Advantage plan, it is a second bite at the apple. If you get a plan that starts January 1st, you don't like it, and you want to change, you can do it during January, February, March of the current plan year. One of the really neat benefits on a Medicare Advantage plan is what's called the personal items catalog. This is a catalog. Essentially, it is all the things you would see in a drugstore like Bartell's or Rite Aid or Walgreens, excluding food, electronics, clothing, magazines, cosmetics, and so forth, and prescription drugs. So it's things like over-the-counter medicine, maybe a walker or a cane, vitamins, all kinds of things. And you get an allowance per quarter from the insurance company. That allowance can vary from $25 up to $50 per quarter. Some of the plans they will give you a debit card, and you can go to a specific pharmacy, or you can do it mail order, and the companies will pay the shipping. Now, one of the things real quickly, a type of Medicare Advantage plan is called a dual special needs plan. This is a plan for people that hold a Medicare and Medicaid card. It is an outstanding health insurance plan for somebody that has these two cards because there's no monthly premium. It is totally inclusive. It includes everything. You can go to the doctor if you have to go to the hospital. There's dental, vision, hearing. For most people, 0 copays on prescription drugs. It's just an incredible plan for those in the special needs communities. And here's some more of it. The dental, $3,000 dental benefit, transportation to and from medical appointments, hearing aids, personal item catalog. It's a terrific plan. Veterans. If you are a veteran and you have VA benefits, I encourage you to sign up and get those benefits. They are there, you earned them, and we are thankful for your service to our country. A huge percentage of vets never sign up for these benefits. I can't stress it enough. Please sign up for the VA benefits. VA benefits, healthcare benefits won't necessarily coordinate with your Medicare benefits, but it's just an extra layer of benefit that you can have. The VA does encourage veterans to sign up for Medicare, to sign up for a Medicare Advantage plan. There are Medicare Advantage plans out there that do not have prescription drug coverage. Those are designed specifically for the vets. The VA prescription drug service is outstanding. There's nothing comparable to it in the country and the world, really. So we encourage you to use that benefit. But if you happen to be out of the area, can't get to a VA facility, get a Medicare Advantage plan, and you'll always have that additional layer of coverage. And it's a great peace of mind coverage to have. You never have to worry about where your health care is going to come from under any circumstance. Medicare supplement. Medicare Supplement operates quite a bit differently than Medicare Advantage. Medicare Advantage is its own standalone policy with all those benefits and additional benefits wrapped into one. Medicare Supplement is what we call following form insurance. It only is going to pay what Medicare, original Medicare, Part A and Part B pays. So it's not going to pick up prescription drug, dental, vision, hearing, a gym membership, and any of those other extra benefits. It's only going to pay what is deemed to be medically necessary. Most of the plans do not have a deductible. Well, no, I take that back. They all have a deductible now of $203. Most of them do not have any co-pays. So once you satisfy your deductible, you just continue paying your monthly premium, and that's your healthcare costs for the rest of the year. You will need to buy a prescription drug plan to go along with these, with a Medicare supplement, so you don't get the Medicare prescription drug plan penalty. Remember earlier I said that if you only had Medicare Part A and Part B, you would be responsible for the copays and deductibles and 80 and 20% of the bill. Your Medicare supplement plan will pick up that 20%. So all you will pay is your monthly premium and at minimum that one-time annual $203 deductible. These plans, Medicare supplement plans, run anywhere from $140 to $240 a month. Prescription drug plans are going to be as little as $8 or $9 a month up to $90 a month, depending upon what type of medications you're on and the dosage. So you want to definitely sit down with somebody and go over your prescription drugs and choose the plan that best fits your needs. Okay, what are your options? And there's really three of them. The first one, well, the top part there is Part A, Medicare Part A and Part B. And there are about 2% of the population Medicare eligible that's all they have. They're healthy, they don't take prescription drugs, and they just have Part A and Part B, and they've kind of rolled the dice a little bit on the prescription drug coverage. The next option is a Medicare supplement plan and a prescription drug plan. This is going to cost you $200 to $300 a month. And again, this is one plan you want to sit down and have a discussion with somebody. For example, if you happen to be on kidney dialysis, you're going to want to look at a Medicare supplement because your copays there are no copays. So your costs are going to be capped at your monthly premium and that $203 annual deductible, and then your prescription drug plan. So if you have a chronic condition, have the discussion with somebody about what plan is best for you. The next option, Medicare Advantage. This is the one that has the bundle of benefits. It's going to cover your hospitalization, all your doctors, dental, vision, hearing, a gym membership, prescription drug. Again, sit down and have the discussion and find out what is the best plan for you. The nice part about anything in Medicare insurance, in the state of Washington, we are what's called a guaranteed issue state. So you can go back and forth between Medicare supplement and Medicare Advantage every open or annual enrollment period, which is October 15th through December 7th, with a policy start date of January 1st. You can go back and forth between the plans anytime, and you can make a change anytime during the annual enrollment period. This is just a chart that what I've been talking about that shows what the plans cover. As you can see, the Medicare Advantage plan by far has the most robust combination of benefits. However, that doesn't mean that is the best plan for you. So again, have the discussion with a Medicare insurance professional to choose the plan that best fits your needs. Okay, here's some resources for you. Medicare, medicare.gov. and there's the 1-800 number, Social Security. And then the extra help that comes from Social Security as well. A lot of information out there. What's not on here is AARP also has a lot of information. And there are other organizations that have information about Medicare. We can help you get the information you need. We have access to these resources, and the insurance companies have a vast wealth of information about Medicare. Trust me, they've been doing it a long time, and we can get the information you need. A very small percentage of people will have unusual or different circumstances that they need a lot of different information. We can help you get that. And here's a glossary of terms. In the insurance industry, like high tech, we throw around a lot of anachronisms, and there's really nothing on here that is unusual, but you will hear it from time to time. And we're not trying to fool you. It's just the vernacular of the industry. So that's our presentation for this morning. Norma, do we want to monitor the chat here and see if?
Yeah,
Let's see if there's any questions in the chat. How do we get to that?
So far, I don't see any questions in the chat.
Okay.
But I know that there was a lot of information. So please feel free to ask Pat or Norma to go back to a slide. If you have questions, now's the time to ask them. And there, again, I think I've seen this Medicare presentation 4 times, and I always have questions. So feel free to jump in if you have any questions.
So we encourage people to, and we'll make this available as a resource guide. There is a lot of information about Medicare. I'm not going to kid you. There's also a lot of misinformation about Medicare. Are we authorities and know everything about Medicare? 100% no, but we do know where to go find the answer. We do have access to the professional people that all they do is deal with Medicare. We're more on the insurance side, but we have a great understanding of the basic principles of Medicare, how to sign up, how it works, how it's going to benefit you. If you have an unusual circumstance and need some clarification, we can certainly get that to you.
Oh, okay. We have a couple questions. So one person has asked, my daughter, due to chronic illness, does not have 40 quarters of work. What happens to her when it comes to Medicare?
Okay. Well, there's 2 options. One, she may qualify for a disability. So she may be able to get Medicare through a disability. And there's 2 parts to that. And I don't want to go into that because it gets a little bit into the weeds. The second part is that if you don't have 40 quarters, you can buy Medicare Part A. It's a little spendy, but you can purchase Medicare Part A. So, for example, somebody's late to the workforce, they don't have 40 quarters. Let's say they have 37 quarters. They can buy, and then they turn 65. They can buy Medicare Part A, and then when they turn, or they get that 40th quarter under their belt, then they wouldn't have to pay the Part A premium anymore. So there are a couple of avenues to Medicare Part A. Need to have, I would encourage those folks to call us and we can walk you through the steps and see if, specifically with the chronic illness, if it's a qualifying disability under Medicare, may be able to get Medicare. They may be able to get Medicare eligibility before they turn 65.
Wow, that's great. And so just to clarify, if somebody has a question regarding that, I think that was you, Sonia, if you wanted to reach out to Pat and to Norma, they can walk you through that whole process. And it sounds like they can actually buy up to that 40th quarter and then flip to where the premium will adjust. Does that sound right, Pat? Did I make that, is that correct?
Essentially, they would still have to be 65, but then they could buy Medicare Part A from their 65th birthday on until they get the 40 quarters.
Okay. And then another question I see here, Ellen asked, what benefit does husband have? And Ellen, you can, if you wanted to pop in and unmute yourself to add on to that. I'm sure.
I thought I said vet. He's a vet, so he has regular Medicare insurance. I just was asking what the benefit would be for him to do the veteran part of it.
Oh.
Well, depending upon what priority class or priority group he is in, he could have access to VA benefits at virtually no cost.
Can I interrupt you for a minute? He's like 40% disabled vet, but then he has to give up all of his doctors. I guess that's what he really isn't willing to do. So
did his disability come as in his time as in the service?
Yes.
Okay. I would really encourage you to contact the VA and they can walk you through that because
Yeah, but he has to give up all his doctors. So I guess that's what I know. I missed some of it that you were saying about the veterans thing. I know it's.
Well, he would see VA doctors, that's for sure. However, they do have the capacity to work with his current doctors outside of VA. Now, here's the other thing the other part of VA I didn't talk about, but VA has a mechanism called aid and attendance, which is essentially long-term care for the qualifying vet. And they will pay a certain amount of monthly benefit for somebody for long-term care. So even though he may have to give up his doctors, it may very well be advantageous to see if at some point if he qualifies and at some point he needed a long-term care, they will pay a good percentage of that monthly bill.
That's a huge benefit. I guess it depends on where they would be, where you would go for that, I guess, if it came to that someday. But
well, it's not like the Medicaid placement where some facilities don't take the Medicaid or don't have any bed space for Medicaid people, but most of the facilities, I have not heard of anybody that doesn't accept the aid and attendance benefit.
Right, that would come typically to him, and then he would utilize that money or stipend, so to speak, to pay for for instance, if he was at our community, Ellen, for that particular bill. There's no typically there's no committed list of locations that you have to go to. So, and I know a lot of things have changed with the VA benefits with regard to private doctors. And so I think if you haven't talked to the VA in a while, like Pat had said, just most recently, we had a good conversation with them, still able to see his private doctors and not necessarily go to the VA and still receive benefit. So definitely would, in addition to Pat, it would encourage you to reach out.
Thank
Now,
you.
the VA does have some nursing care facilities that they own and operate.
Mm-hmm.
However, my understanding is that the wait list to get in those facilities is pretty extensive. But again, that's a discussion you'd have to have with VA. And it's not, I'm sure that the people at Lakeshore can be a part of that discussion and guide you in the right direction on that as well.
Yeah.
Absolutely.
They're not the easiest to get a hold of or deal with. I'll just tell you, that's what our experience has been. So
that's true. So here's a little piece of advice on that. They do have what are called community navigators. And these navigators are really sharp people. We have a contact line where we can put you in, they will give you that. You call in and they will put you in contact with people. I encourage you to use the navigators. Don't try it on your own. I tried it on my own for a friend. And with my understanding of the insurance industry and a lot of other things, it was a nightmare. Once I got to the navigator, it was smooth sailing. So there are resources out there available. They're just not very well advertised.
Thank you.
Ellen, I'll make a note and send you some information, okay?
Okay, thank you.
Annie, oh, go ahead,
I was
Norma.
to say, any other questions?
Let me see. I don't see any other questions. Anybody else have any questions before we let Pat and Norma go and thank them for their time? Okay. Well, as we have no more questions, thank you, Pat, and thank you, Norma, for an amazing and very informative presentation. We will be emailing everyone an evaluation form, and we would love to hear your feedback on this presentation, as well as any suggestions you may have for future Zoom presentations. I know that we utilize Pat and Norma as our Medicare specialists here at the Lakeshore. So they are in and out of our building, helping our residents. So please don't hesitate to reach out to them. They are phenomenal and very lovely to work with. You can also call us for more information. Our number here at the Lakeshore is 206-772-1200. And oh, wait, let me double check. I think we might have, nope, we don't, sorry. Again, my name is Alicia Campolito. Thank you very, very much for joining us. This concludes today's presentation. We hope you have a wonderful rest of your day, and we look forward to seeing you again at future events.
Bye, everybody.
Bye, everyone.